You know that unsettling feeling when you walk into a room and suddenly can't remember why you're there? Or when a familiar name slips your mind just as you're about to introduce an old friend? What if I told you that some of the very medications you're taking to stay healthy might be quietly accelerating these memory lapses and could even be putting you at risk for dementia? This isn't just speculation. A landmark study published in JAMA Internal Medicine followed nearly 3,500 seniors for 7 years and found that certain common medications increased dementia risk by up to 54%. Even more alarming? Many of these drugs are prescribed to older adults for completely unrelated conditions, things like allergies, depression, or bladder problems. Today, we're going to shine a light on 9 widely used medications that could be putting your cognitive health at risk. But more importantly, we'll talk about safer alternatives and strategies to protect your memory, because knowledge is power when it comes to your health. Let's start with the first category of concerning medications: anticholinergic drugs. Now, that's a mouthful, but these are some of the most commonly prescribed medications for seniors. They work by blocking a neurotransmitter called acetylcholine, which just happens to be crucial for memory and learning. The most problematic offenders in this class include 1. Diphenhydramine, found in over-the-counter sleep aids like Benadryl and Tylenol PM. Many seniors take these nightly without realizing they could be clouding their minds. A study from the University of Washington found that people who used these medications regularly had cognitive abilities similar to someone 3 to 4 years older. 2. Oxybutynin, frequently prescribed for overactive bladder under brand names like Ditropan. Research shows this medication can impair memory after just a few weeks of use. 3. Amitriptyline, an older antidepressant still sometimes used for nerve pain. It has particularly strong anticholinergic effects that can linger in seniors' systems. Here's what makes these medications so insidious. The cognitive effects often creep up so gradually that neither patients nor doctors connect the dots. You might notice you're forgetting words more often or struggling to follow conversations, never suspecting your bladder medication or sleep aid could be the culprit. Now, before you panic, let me share some good news. For every risky medication, there are usually safer alternatives. For example, instead of diphenhydramine for sleep, try melatonin or improving sleep hygiene. For overactive bladder, newer medications like mirabegron have fewer cognitive side effects. For nerve pain, alternatives like gabapentin may be better options. The key is having an informed conversation with your doctor, which we'll talk more about later in this series. Our second category of concerning medications are benzodiazepines drugs like 4. Lorazepam, Ativan, 5. Diazepam, Valium, 6. Alprazolam, Xanax. Prescribed for anxiety or insomnia, these medications are especially dangerous for seniors because they remain in the body much longer as we age. Increase fall risk, which can lead to head injuries, have been directly linked to Alzheimer's in multiple studies. A Canadian study of older adults found that just 3 months of benzodiazepine use increased dementia risk by 43%, while long-term use nearly doubled it. Now, I understand many seniors rely on these medications. If that's you, please don't stop them abruptly, that can be dangerous. But do talk to your doctor about gradual tapering plans, cognitive behavioral therapy for insomnia or anxiety, safer alternatives like buspirone for anxiety. As we continue, we'll uncover more medications that could be affecting your memory, including some surprising over-the-counter options and common prescription drugs you'd never suspect. But more importantly, we'll give you practical steps to protect your cognitive health while still managing your other health conditions. Now that we've covered the well-known culprits like anticholinergics and benzodiazepines, let's talk about some medications that might surprise you, the ones flying under the radar that could be quietly affecting your memory and cognitive function. These are drugs many seniors take daily without a second thought, never suspecting they might be clouding their thinking or accelerating memory decline. Take my neighbor, 72-year-old Linda, who was taking a common over-the-counter medication for her seasonal allergies. After 6 months, she noticed she was struggling to recall names and losing track of conversations. Her doctor ran tests but found nothing wrong until a pharmacist finally asked about her allergy medication. Within weeks of switching to a safer alternative, Linda's mental clarity improved dramatically. 7. Proton pump inhibitors, PPIs. Medications like omeprazole, Prilosec, and esomeprazole, Nexium, for acid reflux, are among the most concerning. A German study tracking 73,000 seniors found those taking PPIs long-term had 44% higher risk of dementia, significant reductions in vitamin B12 absorption, crucial for brain health, increased risk of stroke, which can lead to vascular dementia. The problem? These medications are often taken for years when they're only meant for short-term use. If you're on a PPI, ask your doctor about stepping down to an H2 blocker like famotidine. Try natural acid reducers like chewing gum after meals. Never stop abruptly. Work with your doctor on a taper plan. 8. Statins. While cholesterol medications like atorvastatin, Lipitor, protect hearts, their effect on brains is complicated. Some studies suggest certain statins may reduce CoQ10 levels, essential for brain energy, cross the blood-brain barrier in ways that affect cognition, particularly impact verbal memory. However, and this is crucial, other studies show statins might actually protect against dementia. The difference appears to be lipophilic statins, like simvastatin, are more likely to affect cognition. Hydrophilic statins, like pravastatin, may be safer for memory. If you're concerned, ask your doctor which type you're taking. Consider CoQ10 supplementation, 100 to 200 milligrams daily. Never discontinue without medical supervision. 9. Corticosteroids. Prednisone and similar steroids prescribed for inflammation can shrink the hippocampus, your memory center, cause steroid fog that mimics dementia, increase risk of delirium in hospitalized seniors. The risk rises with higher doses and longer use. If you need steroids, ask about the lowest effective dose. Explore topical or inhaled alternatives when possible. Increase omega-3s and vitamin D to counteract effects. Now, here's an important distinction. Not everyone reacts the same way. Your neighbor might take one of these medications for years with no cognitive effects, while you notice changes within weeks. The key is being alert to new memory lapses after starting a medication, difficulty concentrating, or finding words, family members noticing changes you haven't. If you spot these signs, don't dismiss them as just aging. Keep a symptom journal and bring it to your doctor. What's equally concerning are the combinations of these medications. Many seniors see multiple specialists who don't coordinate care, leading to dangerous polypharmacy situations where the combined effect is worse than any single drug. A study in the Journal of the American Geriatric Society found that taking 2+ anticholinergic drugs doubles dementia risk. Combining benzodiazepines with opioids is particularly dangerous. Even non-prescription drugs can interact harmfully. This brings us to a crucial safety measure, the brown bag medication review. Here's how it works. 1. Put all your medications, including OTCs and supplements, in a bag. 2. Bring them to your primary care doctor or pharmacist. 3. Ask specifically about cognitive side effects. 4. Discuss whether each medication is still necessary. Many seniors are surprised to find they're taking medications they no longer need, that safer alternatives exist. Now that we've identified these risky medications, you're probably wondering, how do I have these conversations with my doctor without seeming difficult? That's exactly what we'll cover next, including specific questions to ask and red flags to watch for during your next appointment. Let's face it, walking into your doctor's office and questioning your medications can feel intimidating. You might worry about seeming like a difficult patient or challenging a professional's expertise. But here's what most doctors won't tell you. Your concerns about memory and medications are valid, and the right physician will welcome this discussion. I'll never forget 74-year-old Robert's story. He'd been on a cocktail of medications for years, watching his memory decline, until his daughter insisted he ask one simple question at his next appointment. Is this still the safest option for someone my age? That question led to 2 medications being adjusted, and within months, Robert's family noticed his sharper recall and improved energy. Why doctors overprescribe risky meds to seniors. Understanding these reasons can help you navigate the conversation. 1. Guidelines change faster than prescribing habits. For example, Benadryl was once considered harmless. 2. Specialists focus on one body system. A cardiologist may prioritize heart health over cognitive effects. 3. Time constraints prevent thorough reviews of all your medications at each visit. The 5 essential questions to ask. 1. Is this medication still necessary at my age? Many prescriptions aren't re-evaluated for seniors. 2. Are there newer alternatives with fewer cognitive side effects? Science evolves constantly. 3. What's the lowest effective dose for someone my size age? Seniors often need less. 4. Could any of my medications be interacting in ways that affect my memory? 5. Would you prescribe this to your own grandparent? Gets to the heart of risk, benefit. Red flags in the response. Dismissing your concerns without explanation. Not checking for interactions between all your medications. Recommending continued use of known high-risk drugs without alternatives. When to seek a second opinion. Consider consulting a geriatric pharmacist, medication experts for seniors, cognitive neurologist if you're already experiencing memory issues, functional medicine doctor for integrative approaches. The power of I statements. Instead of, "You're giving me dementia meds," try, "I've been concerned about my memory since starting this. Could we explore alternatives?" Bring an advocate. Having a family member or friend at appointments ensures concerns aren't overlooked. Helps remember recommendations. Provides moral support. What if your doctor won't listen? 1. Request. They note your concerns in your chart. 2. Ask for a referral to a specialist. 3. Consider switching providers if possible. Now that we've equipped you for these critical conversations, let's talk about the most effective ways to track medication effects on your memory, because noticing small changes early could prevent big problems later. You know that feeling when you realize your keys aren't where you left them, or you walk into a room and forget why you're there? Now imagine being able to tell whether those moments are normal aging or connected to your medications. That's exactly what we're going to help you do today, because catching subtle changes early could save your memory. Let me tell you about my friend Evelyn, a 78-year-old former librarian who noticed she was struggling to recall book titles, something that had always come easily to her. Instead of dismissing it, she started what she called her memory detective journal. After 3 months of careful tracking, she discovered her forgetfulness peaked 2 hours after taking her new blood pressure medication. Her doctor adjusted the timing, and within weeks, her mental clarity improved, creating your cognitive baseline. Before you can spot changes, you need to know you're normal. Try these simple tests. 1. The grocery list challenge. O. Write down 5 items you need to remember. O. Set a timer for 2 hours. O. Try recalling them later. O. Note how many you remembered effortlessly. 2. The story recall test. O. Read a short newspaper article. O. Summarize it to a friend or in a journal 30 minutes later. O. Rate how much detail you retained. 3. The clock drawing exercise. O. Draw a clock showing 3:45 from memory. O. Check, are numbers in order, hands correctly placed? Do these weekly when starting a new medication to establish your personal baseline. The medication memory log. Track these details for 4 weeks. Time taken. When you took each medication. Cognitive notes. Any memory lapses, confusion, or clarity. Physical symptoms. Dizziness, dry mouth, or blurred vision. Sleep quality. Poor sleep worsens medication side effects. Mood changes. Irritability or anxiety can signal cognitive strain. Tech tools that help. For tech-savvy seniors, MediSafe app tracks meds and side effects. Cognition app, quick daily brain tests. Simple voice memos, record observations hands-free. When to sound the alarm. Contact your doctor if you notice. Forgetting how to do familiar tasks, using appliances, dressing. Getting lost in familiar places. uncharacteristic poor judgment, falling for scams, personality changes, unusual anger or apathy, natural ways to counteract medication effects. While working with your doctor on alternatives, try 1. Lifestyle adjustments. O morning puzzles to wake up your brain. O afternoon walks to increase blood flow. O evening meditation to reduce stress hormones. 2. Nutritional boosts. O eggs, choline for acetylcholine production. O blueberries flavonoids to protect neurons. O walnuts omega-3s to reduce inflammation. 3. Sleep optimization. O magnesium glycinate before bed. O white noise, if meds cause restless sleep. O keeping bedroom at 65 to 68 degree Fahrenheit, ideal for brain detox. The 30-day medication review cycle. Mark your calendar to 1. Review your memory detective notes monthly. 2. Check for patterns with medication changes. 3. Schedule follow-ups after any dosage adjustments. Now that you're equipped to monitor how medications affect you, let's talk about the most hopeful part of all this, how to repair and rebuild your cognitive health, even if you've been on problematic medications for years. Asterisk. End of Part 4, seamless transition to Part 5. Asterisk. Part 5. Rebuilding and protecting your cognitive health. If you've discovered you've been taking medications that could harm your memory, don't panic. The brain has an incredible capacity to heal, especially when given the right support. Today, we'll explore practical, science-backed ways to not just stop further damage, but actively rebuild your cognitive strength. Take inspiration from 80-year-old Marvin, who after learning his sleep meds might be affecting his memory, worked with his doctor to taper off them while implementing the strategies we'll discuss. 1 year later, his cognitive tests showed improvement his neurologist called remarkable. The Neuroplasticity Protocol. 1. Morning mental warm-ups. O crossword puzzles, verbal memory. O number games, working memory. O jigsaw puzzles, visual processing. 2. Afternoon movement. O tai chi, balance plus focus. O dancing, memory plus coordination. O water aerobics, low-impact circulation. 3. Evening social connection. O book clubs, analytical thinking. O card games, strategic memory. O storytelling, recall practice. The repair nutrition plan, key foods to incorporate. 1. Leafy greens, 1+ servings daily for folate. 2. Fatty fish, 3. X, weekly for omega-3s. 3. Colorful berries, daily for antioxidants. 4. Nuts, seeds, handful daily for vitamin E. 5. Fermented foods. For gut-brain connection, supplement support. Consider discussing with your doctor. B. Complex, especially if on PPIs. Magnesium L-threonate, crosses blood-brain barrier. Phosphatidylserine, supports cell membranes. Creating a brain-healthy environment. 1. Reduce toxin exposure. O. Switch to glass food containers. O. Use natural cleaning products. O. Filter shower water, chlorine byproducts. 2. Cognitive-friendly home. O. Consistent places for essentials. O. Large print labels where needed. O. Nightlights, to prevent disorienting falls. The power of purpose. Studies show seniors with strong sense of purpose have 30% lower dementia risk, maintain better cognitive function, recover faster from medication effects, find your why through volunteering with skills you enjoy, mentoring younger generations, learning new skills, language, instrument, when to seek professional help, consult a specialist if symptoms persist after medication changes. You need cognitive rehabilitation. You want personalized supplement guidance. Your 6-month cognitive comeback plan. Month 1 to 2, medication review plus baseline testing. Month 3 to 4, lifestyle adjustments plus tracking. Month 5 to 6, progress evaluation, plus next steps. Remember, every small change compounds. Even reversing one risky medication while adding daily brain-healthy habits can significantly impact your cognitive trajectory. Now I'd love to hear from you. What's the first step you'll take after watching this series? Share in the comments. Your commitment might inspire others to take action too. Here's to your sharper, clearer future where every memory is worth keeping.